the moment, our top story today is what's happening with the United Kingdom, because there's been a massive uproar with the United Kingdom now forced to revise its travel advisory today, accepting the Serum Institute of India's Covishield as an approved vaccine, that those who are double vaccinated with Covishield can travel to the UK. However, the advisory still puts India in the amber list. This means any traveller to the UK from India will have to undergo a mandatory 10-day quarantine. And there are questions that appear to be raised about vaccine certification in India. Listen in to our top story first.
Covishield is approved by the United Kingdom, but only if it is taken in Antigua and Barbuda, Barbados, Canada and Dominica. But travellers to the United Kingdom from India will have to stay in quarantine for 10 days even if they are fully vaccinated. The latest changes in UK's travel norms, applicable from the 4th of October, have brought no relief for Indian travellers. The new travel guidelines state formulations of the 4 listed vaccines such as AstraZeneca Vax Zevria, AstraZeneca Covishield and Moderna Takeda now qualify as approved vaccines. The UK has not officially given reasons for keeping India in the list of restricted nations. Sources indicate there might be issues with India's certification process. The government of India has already lodged a protest with the United Kingdom over its travel norms and warned of reciprocal measures.
The Honourable External Affairs Minister, from what I understand, has raised this issue strongly with his counterpart, the new Foreign Secretary of the United Kingdom. And I'm told that certain assurances have been given that this issue would be resolved. But if we don't get satisfaction, we would be within our rights to impose reciprocal measures.
The British rules are being widely criticised as a case of vaccine discrimination.
See, I think we need to go a step further, because 10% of the vaccines which have been given to citizens of the United Kingdom have come from the Serum Institute in India, which means that they have accepted for their own citizens the vaccines produced in India. Now, it's not just discriminatory, it's also irrational.
The British High Commission had earlier said that the UK is engaging with the Government of India to explore how it could expand recognition of vaccine certification to people vaccinated by a relevant public health body in India.
And India is also awaiting an emergency use listing approval for Covaxin from the WHO. Currently, talks are on the diplomatic channel as well to make sure that UK reviews its decision for Indian travellers. In New Delhi with Ashwini Helen, this is Milan Sharma reporting for India Today.
So are the current UK travel norms discriminatory against Indians? Is the United Kingdom continuing to doubt the credibility of India's vaccine drive and, importantly, our vaccine certificates? How should India respond? Is reciprocity the only way? Take reciprocal measures. Just some of the questions that we'll raise tonight. I'm joined by Dr. Shahid Jamil, one of India's leading virologists. He's in London at the moment. Dr. Naresh Trehan, Chairman and MD of Medanta, joins me. Dr. Rajay Narayan is Director of the Global Health Alliance in the United Kingdom. Shilkar Sharma, former diplomat, is also with us. Appreciate all of you joining us at this moment. I want to come to each of you to try and understand where you stand on this issue. Dr. Trehan, to you first. Prima facie, it appears that the United Kingdom finally under pressure has accepted Covishield as a 2-dose Covishield as an accepted vaccine. However, there's a question mark over the certification. They seem to be suggesting that they still want to go through whether Indian certificates are genuine or not. They haven't said that formally, but that's what we've learnt on background. That's the back channel that's going on. Does that suggest to you somewhere a lack of credibility in our system or discrimination on the type of on part of the United Kingdom?
Most definitely discrimination. The point is, where is the origin of their belief that the certificates are false? And if there are, like you can see, there are many people who travel on forged passports, forged visas. You don't ban the whole country because you detected 1 or 2 like that. So if there are any certificates that they have found false, yes, punish those people. But I can assure you because we are in the thick of the vaccination process, and we know where the certificates are printed from the Covin site. They are actually, maybe there are a few people who have hijacked the system, but that's not prevalent. And 99%, I can guarantee you, the certificates given are genuine. And also they can be checked on the Covin ad. The Covin app will tell you that yes, they are third and this is the day of their vaccination, and the final certificate that you get certifies that you had 2 doses. So I don't know where this whole thing has come up from. Maybe they detected 1 or 2 people, but then catch them and then punish them. Don't block the whole country.
You make a very valid point. Catch those who are responsible for the who may have tried to push through with fake certificates. Don't punish an entire country. Let's get a UK point of view at this moment. Dr. Rajan, there in the United Kingdom, I just want to, Rajan Narayan, I want to get a sense from you that we are told that there are conversations now on between Covin, the Indian app for Covishield, and the UK authorities, and hopefully there will be a breakthrough. But as I said, prima facie it appears that the United Kingdom doesn't trust India's vaccination certification process. Should that trouble us as a country after all that's after the fact that we managed to achieve a fair amount in terms of vaccinating people, but there's still no trust for the certification?
Thank you, Rajdeep, for having me on the show. First of all, I would like to clarify, we have to step back and we have to understand what is happening between the two countries. Number one, India is a very strategically important partner for UK. Post-Brexit, there are millions and trillions of dollars of trade happening between the two countries. UK has got one of the biggest contingency of diplomats in India. They've got about half a dozen cities in India where they've got deputy high commissioners who are trying to strengthen the relationship between the two countries. Now, coming back to this controversy, India obviously was put on the green list last Friday by the UK government. That means that people can travel without any problems from India to the UK, but obviously that is not the case as we know now. But the problem is that there is obviously some lack of data at the UK end, because again, UK was waiting for some data to come from the Indian government, which has not come through. The High Commissioner has given a statement this morning saying that both apps are discussing some of the problems that have happened between the two apps. So they're trying to clarify those.
No, but hold on. The UK, actually, the certification of the UK is a piece of paper. We've actually got a QR code in place. We've got technology in place. What seems surprising is how quickly the UK, how readily the UK seemed to believe that the Indian vaccine certification process could be falsified. That suggests a serious credibility issue.
I don't think there is anything specifically against India that UK is trying to discriminate, but you also need to understand the public.
They cleared Pakistan and Bangladesh before they cleared India this morning.
Yeah, but again, you need to understand the Public Health England and the NHS as well, because at the moment we are having about 40,000 positive cases in the UK. That means that number of deaths, number of admissions are going up. On top of that, there's a lot of challenges with the NHS because the winter is coming in. So we have to be careful and we have to make sure 100% that whatever we are doing is in the best interest of the citizens of UK as well. But saying that, more than 70,000 Indian students have now landed in UK to study in different courses. If UK government wanted, then they could have stopped these students from coming back. And again, that is a big source of trade between the two countries. And UK wants these students to come over to India, from India to UK, but they will not do something to dampen this.
So you're saying that the UK will not do something to damage a relationship which is pretty solid. But Dr. Shahid Jamil, we come back to where we stand at the moment now as a country in ensuring that our vaccines are recognized across the world. Covaxin still not recognized by the WHO. So if I have double vaccinated with Covaxin, technically I can't travel to several countries across the world. With Covishield, I can travel to the UK if I'm double vaccinated, but I have to have a 10-day quarantine. Now this is a vaccine which is the same as the Oxford AstraZeneca vaccine. Prima facie, do you get an indication of a trust deficit somewhere?
Well, certainly, Rajdeep. I mean, over the last few days, we've seen a lot of energy devoted to this subject. Unfortunately, most of that energy is heat and there's very little light out there. As I speak to you, I'm in Oxford and I traveled here 12 days back. I was doubly vaccinated with Covishield. I had to take the mandatory RT-PCR test before leaving, and had to quarantine myself, home isolation for 10 days once I got here. However, I must point out that the scenes that I witnessed at UK immigration at Heathrow were anything but COVID appropriate. There were about 800 people jammed up in the immigration hall. It took me 5 hours to clear immigration. Of course, there were signs there saying you should maintain a 2-meter distance. So it was all really rather comical. And then, having been vaccinated twice, to have to undergo a 10-day isolation and get 2 more tests. Those tests, the cheapest, cost me about 180 pounds. All that just adds up. And for what? I have not heard clearly whether the problem is with Covishield or is the problem with the certification. And as Dr. Trehan was saying, exceptions cannot be made into rules.
So the problem seems to be, Dr. Jamil, from what we gather, was with certification. Not so much a Covishield is now in the list of approved vaccines, but there were concerns over our certification process that are now being in a way addressed, we are told.
Yes, it appears so. It appears so because you can't have a situation where a vaccine made in the same plant at Serum Institute, 5 million doses supplied to the UK is kosher, but another vaccine called Covishield made in the same factory by the same processes is not. So it does appear that it's a certification process, and hopefully it should get solved quickly.
It should get solved quickly. We are joined also by Mr. Shrikant Sharma, who's been a former diplomat. I'm going to read out the statement, Mr. Sharma, from Alex Ellis, the British High Commissioner to India. We are clear, Covishield is not the problem. The UK is open to travel, and we are already seeing a lot of people going from India to the UK. We want to make the process of traveling as easy as possible. We've been having detailed technical discussions regarding certifications with the builders of the Covin app and the NHS app about both apps. They are happening at a rapid pace to ensure both countries mutually recognize the vaccine certificates issued by each other. The sense I get from this statement is that there is prima facie, as I said, some question. The UK questions our Covin app. They themselves seem to have paper, their certifications on a piece of paper, but they question the Indian app. Is there inherently some discriminatory attitude, or do you believe this is trust deficit?
I think apart from being discriminatory and, whatever lack of trust, I find that somewhere in there's a section which is cussed, because first they use Covishield non-recognition to hold it up. Then when we explained to them and our minister spoke to his counterpart, and then foreign secretary spoke, then they've been in contact. So they said, all right, they announced today that Covishield is acceptable, and WHO has already, for a long time supported Covishield. So it's like, bureaucratic cussedness that, okay, this is clear, but that is not clear. That I find very painful. And
should India, in your view, should India reciprocate by being equally cussed? Bureaucrat? I mean, is this two competing bureaucracies at the end of the day?
No, I think what is going on, like the foreign secretary's statement is very gracious and very sagacious. He says that, look, we will try to resolve the problems, but if you don't resolve it, then we will be well within our rights to resort to reciprocity. So he is keeping the door open to discuss and to resolve it. But given the intensity of the travel, the number of people traveling to UK and the kind of pressures like this description which just now we got, that the Heathrow airport has 800 people milling around and giving a short shift to social distancing. So there is a crisis. So where will you put a person, the quarantine and all that is really, out of... someone's hat.
Can I just stop you for a moment?
Arbitrary.
Can I just stop you from a moment, because I've got Dr. Halima Begum, CEO Runnymede Trust London, and Halima, you have been looking, Dr. Halima, at within the United Kingdom how there are elements of what you perceive as discriminatory attitudes towards patients who may have been vaccinated, towards those who may have been vaccinated, that those perhaps from particular parts of the world, originating from particular parts of the world, are looked at with suspicion. How true is that? Is there an inbuilt racism that we are seeing, or would I be stretching that argument?
Thank you. Good to be here with everyone today. Well, first of all, I think we should be looking at this as a global infectious disease, as we all are, and approaching it as a globally infectious disease. So no one nation or country is going to be, left safe, basically. So that must be the go-to approach with regards to safety, building trust, and actually building a more secure international system that protects all of us. At the same time, I did want to acknowledge that India has made an enormous effort in vaccinating almost 600 million people, or is it 800? So it's 600
We're 800 now.
million at the first dose, and then a further 200 at the second dose. Now, no country on the planet has managed to do that at scale. So this is something that we need to acknowledge and actually congratulate the Indian government for doing. So it puts us really to shame. But with regards to your actual question around vaccine equity and what is happening in terms of whether the discriminatory effect is intended or not, I think we need a serious discussion about this. One thing is for sure, we actually cannot afford to have a system where certain nations are above the rule or are subject to different rules or are preferred with regards to travel. Because as soon as we start having different rules and we cannot be consistent, it actually risks getting to a safe place and having a two-tiered system. Now, in the UK, we did have an issue around vaccine equity and the fact that particularly disadvantaged groups and groups who are from Black and ethnic minority communities, which, by the way, covers Indian Brits, British Bangladeshis, British Pakistanis, we were disproportionately impacted by COVID, but the vaccine uptake was lower in our communities. So there was definitely a trust deficit. There was definitely an issue around confidence building. We then had a national conversation around whether this was discriminatory, intended or otherwise, whether it even mattered whether it was intended or not, because what matters is whether some groups are being left behind in terms of vaccine access and others were somehow being vaccinated and moving ahead and staying fitter and healthier and could go back to work. So the government or the state at large does have to do more to help particular groups who are impacted more and are least resilient to the pandemic. So we did have to have a strong conversation with government to try and build their shared understanding of why certain groups from Bangladeshi or Pakistani or Indian communities were less likely to access the vaccine and how it is that we needed to build more confidence in the system.
That really, Dr. Trehan, is troubling. We've achieved a huge amount with our vaccine just in terms of the sheer volumes. As I said earlier, Covaxin is still not recognized by WHO. So if I have taken Covaxin, double dose of it, I can get access in India to all the facilities where I wish to go as double vaccinated, but I don't get access to most of the world. So an entire, a large number of our VVIPs, we are told, including possibly the Prime Minister, have taken Covaxin, and yet it's not recognized. Should that trouble us or not? Should this be a point of great concern? Should we be putting more pressure on on either for peer reviews or ensuring WHO recognizes Covaxin as early as possible?
Absolutely. I mean, we started off this conversation with the fact that we're dealing with a globally infectious disease. Well, who is the international player on the scene that's responsible for peer review, verification, consistency, harmonization of which vaccines are recognized, which certificates are recognized? Well, that would be the WHO. But WHO by itself really can't pull this off. I think it needs the kind of support of leading nations of the world to come and support it, achieve this peer consistency, really, because unless you have that consistency, you will have a dual two-tiered approach that feels discriminatory to individuals and citizens and nations. I mean, that is the problem, isn't it? It might not be intended to be discriminatory, but certain groups, certain countries are being left behind.
Dr. Trian?
I also feel that, you know, as somebody said earlier, is this a bit of a kind of a showdown between bureaucracies? I wouldn't say it's a showdown, but I would certainly say the bureaucracies in the UK probably is a little bit behind. We just need to get the bureaucracy up and running to recognise the certification process for India, because, as you said, we are actually looking at a product that's been manufactured in India. That's fine. That's all kosher. But somehow the certificate and the verification isn't right because it was administered.
You know, the point I want to make to you, Dr. Trehan, what should India do in your view? I keep mentioning Covaxin as a test case. Your view, Dr. Trehan?
So, you know, there are two different issues here. Covaxin was actually developed in India, but ultimately it is the data that has to speak for itself. So once enough data has been submitted to the WHO already said, look, it's a process which will have to go through all the conniptions and it may take 2-3 months. That's an unfair thing, I mean, the sense from the people who got the vaccine, but it's not unfair from the international standards.
Sure, but it's taken 6 months, doctor.
So I think that that's fine. The issue here really is licensed from AstraZeneca, Indian vaccine, which is of the same quality, enough data to show that it provides huge protection. We know all our data from India, huge amounts. So why should then UK start, even if it is the certification process is more robust in India than most other countries. Like you said, it has got a QR code. You can go to the CoWIN app and you can actually verify whether it was done or not. So why do we really have to put people now? This is a very important factor, that 70,000 students have been allowed. They've been allowed because that's money. That's huge amounts of fee paid by them to the universities. So if that is a trade issue, then what's wrong with the people? Why are you keeping people away from their families? So I think it's very important that we fight with logic. There's no point saying we will retaliate, because then two wrongs don't make it right. I think we should keep insisting, we throw it at them again and again, throw the data, whatever the doubts are, we should clarify them. We have a very, very robust CoWIN app. I don't think anybody in the world can doubt it. And if there are any loopholes that they have discovered, then maybe we can say, okay, those people must be punished. But also, if there is anything else we can do to make it more robust, why not?
Yeah, but Dr. Jamil,
how other countries do different reactions.
But Dr. Jamil, do you see enough logic in the Indian argument at the moment? Do you believe we have a strong enough case? There have been concerns, of course, in the UK and other parts that because of Delta, because the Delta virus was seen to emanate in a way from India, went to other countries, was seen to be contagious, there was a fear factor. In fact, in background, what we are told is one of the concerns why India remains a country of concern is because the number of cases still are higher in India, just in terms of absolute numbers compared to other countries of the world. Does India have a strong case to go to the United Kingdom and say, look at our vaccination program, 80 crores, look at our CoWIN app, we're on the right track?
Yeah, Rajdeep, I'll come to that in a minute. Let me also clarify the Covaxin issue that you raised.
Yes.
You know, WHO doesn't go around giving certification to every vaccine that comes along. Vaccine companies have to submit documentation and then WHO pre-qualifies that vaccine. It just happened that Bharat Biotech took time to put together everything and give it to them. And WHO has been on record to say that their next advisory committee meeting is on October 4th. And most likely Covaxin is going to go through. So that's about Covaxin. Now, as far as India's program is concerned, India has a very robust vaccination program. We have fully vaccinated about 214 million people, and another 620 million have received one dose. You know, we are second only to China in terms of the numbers of doses given. So, there is no point in doubting this program. And of course, Serum Institute is a very respected vaccine manufacturer. Serum Institute is making pediatric vaccines for, most of the world. So I really don't know where the problem is. Yes, I think it's important for the two countries to continue to talk. You can't really defeat a ridiculous situation with an even more ridiculous situation. So let's continue with the conversation at the levels of the government, and I'm sure a resolution will be found pretty quickly.
So clearly, in a sense, the bureaucracies of the two countries need to get their act together. More than this being seen as racism or discriminatory, somewhere there seems to have been a deep bureaucratic mess in the manner in which this has been dealt with that needs to be addressed almost straight away. Somewhere our system needs to look inwards, as does the UK system, and find a resolution at the earliest. You cannot have two rules for vaccinations across the country. I appreciate my guest joining me there on the talking point. I hope this issue is resolved before October 4th, sooner rather than later, when the new travel rules come into force. Thanks very much for joining me.